So, so what do we provide? So if I just try to bucket the solutions, so I talked about the problem. Now if I come to the solutions, so what are the solutions, informatics-based solutions, which are there in the healthcare domain? So I have just mentioned 6 major categories. The first one is prediction. So prediction is actually predicting a clinical outcome or any outcome from some particular predictors or features. The next part is cluster identification. So suppose we have a cluster of patients. Now we want to identify that which cluster is a high risk group, which is a low risk group, which is a moderate risk group. So these things also we can do using the AI-based techniques. Nowadays, there's a very trend of using Fitbits and wearables, which help us stream real-time data, blood pressure data, and pulse data. So all these things, we use time series modeling for prediction. So to predict a clinical outcome, predict a sudden clinical outcome. So these things we do using time series analytics. Then there is something called image analytics. So for image, we have CT scan image, we have X-ray images. So all these things, we also use informatics for the purpose. Lastly, we have also clinical notes. So OCR is a very important technique which we use for informatics. So in case of OCR, we actually scan clinical notes, handwritten notes, extract the information from there, then apply NLP-based techniques to generate insights, maybe the most frequently occurring diseases or the most frequent complaint and all these things. And this also falls under the domain of informatics. Lastly, we can combine these major solutions to build up customized solutions. So I just gave 3 particular more specific use cases. So we can identify cancer subtypes for more precise therapy, because as you know that cancer is a disease where some persons respond to chemotherapy, some don't respond. Some respond to a particular drug regimen, some don't respond. So if we can detect the cancer subtypes, that can help us to inject a particular specific drug regimen, which is known as precision therapy. That is also done using health informatics. We can detect and classify tumors from X-ray image and CT scan. And lastly, a very interesting thing is mental health nowadays. And by using social network posts, by using NLP, we can detect mental health problems. So this is an overview of the modeling which we use for health informatics. So first of all, we do have multiple types of data. So being able to explore the data types, having a know-how of how they look, where to find them, how to structure them, how to make them very simple for predictive purpose. So that's a very big challenge in health informatics. So we generally have electronic health records, we have wireless devices, we have medical devices, clinical notes. There are multiple types of data sources. Now, all these data sources have to be converted into a machine readable format for modeling purpose. So this is a very important area of healthcare data. And this requires lots of expertise and insight to do that. So the first step is data preparation from these multiple data sources. After data preparation, we can bucket them into specific subgroups, demographic features, comorbid conditions, surveys, vitals, like that. And those things we can input to a training set for the model training, and we can use them to predict a particular clinical outcome. And we will also test it into a different and independent set, and we can use it in that fashion. Now, as new data comes in, the training would become more and more precise, and the model would get updated accordingly. So this is a very general overview of modeling. So I just wanted to mention it. So we will be using multiple types of modeling. We will be learning multiple modeling techniques in the course, more specific. And of course, we will also be doing some very hands-on experience from our example data set and predicting the condition from ourselves.